All right. Hello, everyone. My name's Tom Stark, and thank you so much for taking a look, taking a listen. One of the things that I like to do is that I like to interview entrepreneurs to talk about their business and their business ideas, why they are getting into business. But I also like to give the opportunity for that person to talk some about their business and why they're doing what they're doing. So I'd like to introduce you to someone very special to me, and it's my brother, Jim. Jim has been a physical therapist practicing in Western Michigan now for
25 years.
So, okay, 25 years. I was going to say 3 decades. I don't know which one sounds better. But he retired from his career as an employee back in April, and has changed his focus. He's still working in the field of physical therapy, but he has a very specific discipline that he's working with now. So I want Jim to explain a little bit about that, but also to explain that transition, from being an employee into being an entrepreneur and why that change. So what was that about?
Well, first of all, thank you, Tom. I really appreciate the opportunity. So the change has been, I would say, stunning, because it's really not an area that I had a lot of comfort in terms of business and trying to build a business and trying to build a marketing plan. What I did have was a tremendous amount of information and content about how to treat patients. My focus is now on attempting to train other health professionals, physical therapists, occupational therapists, physicians, about methods that are more evidence-based in terms of treating patients with persistent or chronic pain.
So a lot about pain management.
A lot about pain management.
And it's interesting, because I know at the end of my career, and I was also in healthcare, behavioral health, that whole idea around pain management was getting more and more attention. And especially as the opioid epidemic, or the prescription medication epidemic, has become more and more rampant and more public, so that more and more people know about it, that this whole idea about pain management becomes more and more critical.
It does. It does. The assumption that most people have is that pain is a reflection of tissue damage, and the only way to fix that is either with surgery or with drugs. It's really not an accurate reflection. The longer you've had pain, the less likely it is that tissue damage is still driving the pain. But the methods that physicians use to treat are primarily medication, and they were asked to do pain management in a heavy-duty way. As a result, we now have people dying, almost 800 last year in the state of Michigan.
Isn't it amazing? It's almost, 3 a day, something like that?
Something like that, and just with opioid overdoses. I got started in this in part because the son of one of my colleagues died from an opioid overdose. He was only 16. They were not his opioids. But the physician was prescribing them to somebody who didn't really need them, and they were using recreationally. And that's one of the things we find, is that people who, once they've been on opioids, it's hard to get off. They're 2.7 times more likely to have an opioid abuse problem if you were given a prescription for opioids following wisdom tooth extraction. University of Michigan published that last week. So
yeah, and a simple thing like that. Who would have thought that would have led to an addiction? But it's very common that those types of things happen. And it was happening in my industry as well, in the behavioral healthcare field. We would see our psychiatrists begin to prescribe medications for people that really were not going to be beneficial to that person in the long run, that it was going to be more addictive than anything. And it may have helped with an initial reaction to pain, but it certainly wasn't going to relieve the pain in the long run. It simply was going to perpetuate it through the addiction.
Well, people do develop basically not only a tolerance, but actually an inflammatory response to opioid medication. So your nervous system becomes actually more inflamed. Therefore, you need more medication to get the same pain relief, and this cycle escalates. It's stunning the number of patients that I've had over the years who've said, I was so afraid to get off my opioids. And I can't say my pain is better, but it isn't any worse. The opioids weren't really helping. But my mental clarity is better. My quality of life is better. And the other tools that we were working with, which largely were behavioral, not exclusively, but largely behavioral, were the things that started making a difference in their quality of life.
So, Jim, what's the name of your company?
Aphora Pain Education, Aphora, which is a Greek word, which is used to designate an experience that is almost impossible to describe. And people who have persistent or chronic pain, when they try to describe what's going on to the physicians, they can't do it. Just as you are not able to describe what it feels like when you when you feel you see a sunrise or a sunset or aurora borealis, or what it feels like to you when you see your grandchild smiling and laughing. Something I hope to do a little later today.
Or the expression of love.
Exactly.
There's all kinds of things out there that we kind of know it when we feel it, but we don't necessarily know how to describe it. And pain certainly fits into that category.
Yes, it does. And one of the things that we do, though, as humans, we always try to make meaning out of what we experience, right? And so the story that you tell yourself about pain, the story assuming that there is tissue damage that's driving the pain, is a story that actually creates more of the problem. It's hard to recognize that pain can persist even after the tissues have healed, but it does with lots of frequency. And so it's the story that you learned from the society, but also from your healthcare providers. We have to own up to the fact that we have caused some of this problem because our training has been inadequate.
Yeah, and I saw the same thing, and I think that's very true. And we talk a little bit about some of the statistics here in Michigan, and yet it's not just a Michigan problem. It's not even a U.S. problem. No. I think one of the first things that you did after you retired from your job is you went to Norway.
I did. I went to Norway because there was a conference that I wanted to go to called Pain Cloud, and it was a fascinating time. And one of the things I wanted to find out was, how much is this related to the United States? And I was stunned to find out that Norway actually has some of the highest levels of disability, the highest level of disability in the world, because of persisting pain. You'll notice that I'm using the word persisting pain as opposed to chronic pain. And I use that word carefully because chronic kind of implies something that's never going to get better. Persisting just says, right at the moment, it's still there longer than it should be. You can change it. Not everyone can. It's hard to do. It's not an easy thing. To go back to the chronic phrase, chronic conditions don't respond to acute solutions.
That's true. That's true. So, Jim, what's the easiest way for people to get in touch with you?
The easiest way at this point would be through my website, which is aphorapaineducation.com. And that would be jim@aphorapaineducation.com if you want to send an email.
Okay.
There's also a Facebook page of that same name. And just getting started. But what I'm working on is to create programming to train other physical therapists, occupational therapists, physicians, that sort of thing, to the more up-to-date information about pain.
And you have a curriculum that you're developing, some of which has already been accredited, right? Or certified in terms of CEUs.
Accredited for CEUs for physical therapists in the state of Michigan at this point.
Okay. But the plan to roll it out will be for a much broader spectrum.
Yes. There is a 17-year gap between what is learned in research to what is clinically practiced. And one of the ways of closing that gap is to have people like me become obsessive about it and start talking about it and try to spread the word.
And one of the great things about what you're doing is that, you had a lot of years and a lot of successful years working for other people. But now that you've kind of, I don't want to say divorced, that's probably not the right word, but you've separated yourself out from that part of your industry. Now you're able to focus all your time and all your attention on pain management, on how to improve the quality of people's lives.
Yes.
And not just the people's, clients or patients or however people want to label, but also with professionals and how people can begin to work together and communicate more clearly as to what's happening in a person's life and how we as professionals need to engage.
I felt very strongly that I could help people one-on-one in the clinic, but I could help more people if I could get other clinicians to understand this stuff. And I really want to help more people. It's a challenging problem.
It is, but now you have the time in which you can do that. You have some of the resources that you need where you can devote the time.
Yep.
But you know what? It's a good thing. It's a great thing to watch how your perspective is growing, especially as a business owner, as a marketer.
That's hard.
It is. Yeah, it's not the easiest thing in the world.
Yeah.
And yet it's a timely subject, and it's one that's getting more and more attention in the press. And it's just vital. How do we deal with people in pain and improve the quality of their life? Because so much of it it's not going to be found in medicine.
No.
It's going to be found in other interventions.
It's going to be found in getting better sleep, respecting the fact that we need sleep, having better diets, moving more. There's no medicine that can substitute for good sleep, and no medicine that can substitute for continuing to move. You don't need to join a health club. You just need to keep moving.
Yep, amen. All right, well, Jim, thank you very much. This has been a real pleasure, and we look forward to watching your business grow, to see your content and how that develops over time, and just to know that there's a difference that's being made in a new way, even though you're not doing it in the old way that you used to. So congratulations, and thank you for this time.
Thank you very much, Tom. Appreciate it.